Good afternoon, Felicia Ash with ABC 7, back with another story about the Cedar Hill Regional Medical Center. If you remember, I first reported on issues at this hospital back in October. I told you the story of a father who came here in dire need for help, ended up waiting for hours, then had to be airlifted to another hospital. Days later, he ended up on dialysis. The DC Department of Health, they followed up on his case and found multiple violations in Cedar Hill as it relates to his care. Well, I'm now learning that the issues inside of the hospital are now catching the attention of DC leaders. We also learned about issues with billing. I spoke with Councilman Trayon White today, and he told me that the hospital has not had proper billing services since it opened, and because of that, they're losing $5 million a month staffing. Staffing is still an issue. When the hospital first opened, you remember the big ribbon cutting, the bands, the songs, the speeches. They said at that time that full staff would be 600 people. Councilman White shared with me that there are 500 vacant positions inside of this hospital right now. Now, what I did learn is that council members have now sent letters to the hospital demanding and requesting answers to the conditions inside and what they're doing to fix this. But I've heard from many of you who have shared that you have come to this hospital, needed help, and ended up being sent elsewhere after hours. Councilman White also confirmed that with me, saying that this hospital continuously keeps sending Ward 8 patients outside of Ward 8 when they need help and when they come to this hospital, when this hospital was built for Ward 8 residents, but for all district residents. If you remember, this was a $400 million investment. More than $400 million of taxpayer dollars was invested into this hospital. So when I spoke to the community, spoke with patients, and spoke with DC leaders, they are saying that they deserve more, they're owed more, and the hospital and the people who run it have to uphold their promises. So of course, we're going to continue staying on top of this story. The community has said they want this hospital here, but they want it done right, and they want to make sure the people that they're here to care for are also treated right.